Hello YouTube, welcome to Dr. Vibes. This is a continuation video of JVP. In the previous video, I have discussed about the different waves of JVP and their physiological significance. So in this video, we will revise that significance and we will mainly focus on the pathological causes of the enlarged or absent JVP waves. Now, you will only tell me what are the physiological significance. There were, as I told you, 3 ascent and 3 descent. A, C and V were the 3 ascents. X, X dash and Y were the 3 descents. A, atrial contraction. After that, atria will relax, so there is a descent. When atria will relax, ventricles will contract, leading to the bulging of the tricuspid valve, so there is an ascent. Then, followed again by V, which is increased venous return to the right atrium. So V is an ascent, and then right atrium will empty into the right ventricles, causing the right descent. Now let us see the pathological significance. In some cases, A wave is absent. That means when atria is not able to contract more. That can happen in case of atrial fibrillation, when contraction of atria is not proper. When can A waves be enlarged? Now this is a concept here that you must know. So this is a heart, a very schematic diagram. This is the superior vena cava, this is the inferior vena cava. Here you have the tricuspid valve, here you have the pulmonary valves. So consider if there is a stenosis in the tricuspid valve, blood will accumulate here and that will lead to increased JVP. If there is a stenosis of the pulmonary valve, the blood will accumulate here, which will further go here, and then that will cause increased JVP. So can I say that enlarged A wave is seen in tricuspid stenosis, pulmonary stenosis? And suppose if your right-sided heart failure is there, then heart will not be able to pump blood, so the blood will again accumulate open, and then that will also cause enlarged A wave. So heart failure or heart block. Now, come to X descent. X is due to atrial relaxation. So here you have to remember a mnemonic that is tax pay. T for tamponade, cardial tamponade. So in tamponade, X will be prominent. X will be prominent. And there is another mnemonic pay, tax pay. In P, that is pericarditis, Y wave will be prominent. So we are done with when is X prominent, cardial tamponade, when is Y prominent, pericarditis. Now you have to know when are these waves absent. When is X wave absent, when is Y wave absent. So X wave is absent when you see that C and V wave have enlarged or have merged together, right? If you see my previous video, you will see that there is a X which is followed, there is a A which is followed by X, then there is a C which is followed by X dash, and then there is a V which is followed by Y, right? So if C and V have merged together, we find no X wave. This is seen in case of tricuspid regurgitation, which is very, very important question. When you see CV wave or when X dash or X is absent. Lastly, as I told you, Y is prominent in pericarditis and Y is absent in case of tamponade. So you just have to remember 6 pathological conditions. A wave absent 1, A wave enlarged 2, X wave prominent 3, X wave absent 4, Y wave prominent 5 and Y wave absent 6. That's it for the JVP.